Thank you for tuning in to our second in the series of webinars for patients, learning how to help keep your clinic, help your clinic keep your information private. Sorry. Today, we're going to go through a number of issues around privacy compliance, what clinics are expected to do, what they do to protect your information, and how you can help participate in clinics keeping your information safe. Recommended audio settings. First, real quick, we do recommend that you use computer audio in the audio settings tab of your go-to webinar panel. If you have the phone, you can dial in. We obviously don't recommend using no audio. With me today is Ingrid Rise, who is a privacy expert with a couple of decades of experience. We were just talking about that. Helping thousands of clinics maintain their privacy compliance so that the information that they hold is protected and safe, and we keep patients from suffering privacy breaches, which we'll get into why that's important. We're going to talk about breaches that are happening. Unfortunately, they are on the rise, and we'll talk about what clinics have to do, what the regulations ask of them, what the risks are to both patients, so yourself and your clinic, and then what causes breaches, how can we avoid them, how can we help, and then as we look to still maintain access to care in the age of social distancing, how can you have safe access to virtual care? And then we also have a winner of a draw at the end that we will get to. So clinic privacy breaches this year, and Ingrid, chime in at any time, but we've seen a massive rise. Unfortunately, due to a number of circumstances surrounding COVID-19, we have a lot more people working from home. We have people not trained or educated in some of the things you need to be aware of around cybersecurity, and there is a massive rise in the increase of ransomware prevalence throughout healthcare and sort of around the world as cybercriminals aim to take advantage of people's nervousness, we'll say, or thirst for information around COVID-19. A lot of fake emails coming out from the claiming to be from the World Health Organization, for example, that is meant to trick people into clicking onto things they shouldn't, that downloads bad viruses onto their computer that then spread to anyone potentially that they're connected to through email. So we're going to talk a lot about how you can protect your clinic and help them keep you safe and everybody else, and even sort of the greater healthcare network safe by not using email with your clinic and using your secure email account instead. So we'll dive in here, and Ingrid, this is really sort of your area of expertise here. Do you want to talk a little bit about the clinic's privacy requirements?
Yes, correct. So the bottom line comes down to providers, healthcare professionals, and clinics have an ethical and professional obligation to protect the privacy of a patient. I mean, it's mandated in the Health Information Act, but also there's an onus, an obligation on them to protect your information as a patient. And it's a critical component because it also includes video or email or any other segue into the patient. It's huge, and what we're really finding is everybody had to drop everything very quickly and move to home and isolated settings. And people that normally went to a clinic actually had a huge wake-up call in how to transition into working from home. And we're talking clinicians and physicians. Everybody had a huge change. This is why.
Right. And so, looking at the areas, privacy compliance falls into a few different areas of the clinic. Can you talk about the safeguards that are required and what the tools are that clinics can use to help keep information safe?
Right, so when you come into a clinical setting, you actually, as a clinic, as a custodian, we call them, of your patient information, you must prove that you're managing everything administratively fine. Physically, you're maintaining the privacy and security of the patient records and the technical obligations that lie with clinics to make sure that you're protected. And that includes, firewalls and having the proper protections in place from a technical point of view. And that includes email, same as physical, make sure your building is protected. Administrative, make sure your staff understand what the rules and regulations are. So that includes using all the secure tools such as a secure email to transfer and store your patient information.
Yeah, and I will add to that an important point. We do hear the odd comment from a patient that says, I don't want to use this service. Just my doctor can just email me. And you or us or as patients, we don't have the right to absolve clinics of their responsibility to protect information. So just because I prefer to just use email or something that's not secure and I'm not concerned about my own privacy, there are a number of risks, beyond your own privacy that clinics can expose themselves to, or you can expose clinics to by accidentally using the wrong tools. So clinics have to be aware of the responsibility. It's up to them to maintain the privacy of your information. They have that responsibility that unfortunately only the government can absolve them of, and they will never do that.
And yeah, exactly. I was going to say, even if you consented, said it's okay, use my Hotmail account, there's no clinic in the world that's going to want to take that risk of sending something through Hotmail, because the clinic will wear it in the end. So it's very important to know that it's secure on both ends is the best way to do business.
Yeah, absolutely. So we'll talk about the risks to patients, and we've sort of put this information out quite a bit because there is a perception publicly that patients don't typically care that much about their privacy and they don't see healthcare as a risk, and that's obviously changing significantly and very quickly. When the government of Canada does the research, they said that about 94%, I believe, of Canadians do care about the protection of their privacy. We see very similar numbers when we poll our patients, and we have about 80,000 patients on SecureMail, and about 96% of those that answered said, yeah, I do care deeply about the protection of my privacy. And here's why. Ingrid, do you want to kind of go through these and how this happens in terms of the risks to patients?
Well, a huge thing is identity theft. The last thing you need is your information stolen. It's actually worth money on the black market to have medical information stolen. So you don't want to risk identity theft. Bodily harm, it's not really as big a priority. Humiliation, absolutely. Just imagine your patient record being displayed on Facebook, and that is a situation that we've had a breach with. So it does happen. Loss of employment has happened when medical files accidentally went to a boss instead of to the employer or employee. So again, it's a huge risk to the patient. Financial loss, there's enough financial problems. You don't need to add that to your list of woes. Damage to your reputation or relationship. So an ex perhaps getting access to your information. Business, professional opportunities lost because of this information being released, or damage or loss of property or negative effects on the credit record. All are known risks to the patients that have been identified over the years.
Yeah, and I will say that this list actually comes from the federal regulations in Canada. So if you look up under PIPEDA, where breach reporting, so any organization that suffers a privacy breach now has to report that to anybody who's affected by that breach, as well as the Federal Privacy Commissioner and the Health Minister as well, so that we're tracking that. And part of that reporting is, what are you going to do to solve those issues? I think sometimes, depending on your clinician that you might see or the provider that you're seeing at the time, there is a sense that sometimes the patient information that they have is benign. Who cares if I have a cavity? Maybe. We don't know what the implications are, and it's not up to us to decide what information should be considered private or not. And in that sense, the government has said that all information is considered private, and basic demographic information that's contained within your patient record is actually enough for some of those bad actors, those cyber criminals, to execute an identity theft, and that can have huge implications on your credit rating and employability and all that kind of stuff too.
Right, and medical information is medical information. It may seem kind of small to have a cavity, but however, if it's other repercussions that come of it, or in that same record happens to be your credit card number or your payment method, you have now lost more than just a cavity.
Yes, yeah, absolutely. And now, that sort of talks about why individually, we should be concerned about the protection of the privacy of our health information. But you know, as part of sort of efforts towards the greater good, we'll call it, you know, the more we can do to help our clinics stay safe, the better. Because, you know, imagine even if you're in a large city, you know, your community, if you lose a clinic because they're shut down for a few days or weeks or months or permanently due to, you know, something like a ransomware attack, and that does happen quite often. You know, we don't want to impact the accessibility of care throughout the system. So as Ingrid said, patient records are worth up to $150 on the black market because I can't assume your identity typically with that information. So we want to make sure that that's protected. And you know, Ingrid, you know better than I do some of these risks to clinics and how real they really are.
Right. So the law states actually that if you have a breach, whether it be through you know, lack of proper use of messaging or sending out information, it isn't just reputation damage, but you actually get sanctioned not only by your professional organization, but by the privacy commissioner. So you know, fines, lawsuits, closure. So typically in a lot of areas, admittedly primarily in the States, clinics technically close down usually within 6 months of a major breach, and it takes nothing to breach. If you can just imagine, you know, sending it on Hotmail and all of a sudden a hacker gets in, and like the statement says, you need to be right all the time. Hackers only need to be right once, and that is more true than we want to admit.
Yeah, and that's unfortunate. It can be tempting to say, I sent it the right way all the other times. This time, I just feel like I want to do the unsafe thing because it's a little bit more convenient. You know, we don't want that to be the time that that the bad things happen. So, you know, it's important to be vigilant because the criminals that are trying to execute these types of breaches, for some of them, this is their job. You know, when we talk about things like ransomware, the average cost or the average demand for a ransom when someone locks up the data contained within you know, a clinic or a hospital facility or a business, the average demand went up from at the beginning of 2019, it was around $12,000, and now it's up very close to $100,000. So the demands are going up, and what's changed too there is that previously what they did was, we have your information locked up, you can't access it until you pay us. Now what they do is they say, we have your information in our hands and we will release it unless you pay us. So there's way greater risk now as that situation continues to evolve. Causes of privacy breaches. You know, we talked about ransomware and phishing emails. We'll talk a little bit about how that comes through, but Ingrid, can you talk about, you know, the reality of how frequently this happens in clinics and what we see as we work with the clinics that we do?
So as you pointed out, this happens actually quite a lot of times. So I know of an example hopefully coming is just of an instance where you know, a physician just thought, you know what, it's just so much easier just to use my Gmail rather than a secure mail, and actually was hacked. And so there's situations like that, but we have discovered more and more and more ransomware is coming in through the front doors of the clinics. And it's coming in because the receptionist or the medical office assistant that's at the front sees an email, woohoo, I get a refund, clicks on the email, but it's really a link. And they just now have accessed your entire patient record set. So it's a huge thing. And it's one of the biggest leading causes of our breaches.
Yeah. And so what we talk about in that sense is, you know, you're very lucky to be on this webinar because it means that you have a secure mail account, that your clinic is taking the steps and the precautions, and it's important that you help them do that and continue to use it, because you don't want to be this figure in red in this illustration. You don't want to be the person that clicks on the link or through your connections in your contact list, that those ransomware infections use to spread themselves. They get into your contact list, they send emails to all of your contacts, and if your medical clinic or your dentist office or your chiropractor is in your email inbox, they are now at risk too, and as a follow-on, all of their patients are. So we want to make sure that we're eliminating those connections, and we'll talk about in the next slide, which I'll go to, about the difference. So if we look at how email works, so down on the bottom, the grayed out sort of images there, you can see that there's a lot of stuff happening, and every little yellow arrow is an opportunity for intrusion into the path of that message. So if I sent an email right now to Ingrid, and we're in different cities in the same province, but it might go through different countries that have different laws. We have no way to track who's accessing that information. So we have to sort of cross our fingers and hope nothing bad happens along the way. And the privacy regulations, rightly, don't allow us to cross our fingers. We have to be certain that that information was protected at all times. And that's what Brightsquid Secure Mail does. So you can see, instead of a cloud with a bunch of different servers that we're bouncing around, we just have one single server. When you log into your account, you're establishing a secure and encrypted connection between your device, if it's your cell phone, your mobile phone, or your tablet perhaps, or a laptop or desktop computer. All of that works, as you likely know, and we can maintain the privacy and security of that information within our own private and secure servers that we maintain the security of, that we audit regularly to make sure that we're in compliance, and that we are taking all of the necessary precautions to ensure that the information is protected. For example, in that sense, for certain regulations that we're complying with, there's over 140 different items that we have to check to make sure that we're maintaining the privacy of that information. Ingrid, is there anything that you wanted to talk about in these path diagrams?
No, to me, it's fairly straightforward and clear. The biggest risk, again, the more points of entry or the more areas that can be infiltrated and are not protected are where your risk comes in. So you're only as good as your weakest link. So if somebody's using Hotmail versus Secure Mail, it opens up a link if you're not going in through securely. So I think it demonstrates it well, but
yeah, exactly. The point there too is, sometimes people will rely or fall back on an encrypted email, and in that sense, it's still following this unsecured path. Decrypting techniques are evolving rapidly, and you're still relying on email. You still have that habit of clicking on links within email that could potentially be dangerous, and the secure mail system actually blocks any dangerous viruses by looking at files that people are trying to upload to the system and assessing whether they're a threat. And if they are, or potentially a threat, we don't allow them into the network. So email is the #1 attack vector in healthcare. If we look at the stats last year, from the first half of 2019 to the second half of 2019, the number of attacks like this in healthcare grew by 75%. So we want to make sure that we are not using it anywhere around the healthcare environment. Ingrid, you mentioned this case. So a physician in Calgary almost a year ago was using a regular Gmail account with patients and had been for years. So there was now 7,000 patients in this physician's contact list in their inbox, and their account was hacked. So what are the implications of that when that happens?
Well, the implications were huge. So the reputational damage for the physician, it was in every newspaper. It was all over the place. I mean, and people were mortified to know that their health information, very sensitive information, was out there and exposed for anyone to see. And of course, when things are hacked, you don't know whose record is going to show up when, where. It could be a few years down the road, could be next week. And it's just a terrible thought to know that your health information all of a sudden in 6 months shows up at, Facebook or on Twitter, or, so you don't know those things. So it was actually terrible, because it was health information. The physician knew better. They knew that they weren't supposed to use this means of emailing patients. And it's just not, you think about it, that's my information, or could have been my information out there. It's just not a good feeling.
Yeah, and to the other sort of really bad thing about here is now if you look at sort of point number 3, whoever had access to that account could now impersonate the doctor, because as you send email to somebody, there's the only validation that it's really you is the address that it came from. And that becomes a dangerous situation. People do use healthcare information to get prescriptions for, maybe narcotics that they need, but they can also, impersonate a doctor. There's a lot of damage that they can cause. So we want to avoid this at all costs. And I will point out that, any of your providers that you work with can get access to SecureMail. It is one of the only systems that allows anybody to join, regardless of their professional designation, regardless of if they're a professional or a patient. So it is built to be inclusive of your entire circle of care, so you can really build that network of trust. And we'll get to a slide in a couple of minutes about how you can really build that out in Alberta. I will point out to you quickly as we're coming up to the end, there is a questions tab in your GoToWebinar control panel. If you have any questions for us, certainly type it in. We're all on mute to block out the dogs and crying babies, as one of our directors says. But certainly please submit any questions you have as we go through this. So safe access to virtual care is SecureMail. When we look at how telehealth or virtual care is provided around the world, this pie chart represents a study that involved 36 million instances of virtual care at a very large healthcare provider across the Western US. And when they analyzed how they're providing virtual care, 83% of the time it's through a secure email or secure messaging system. Video is less than 0.5% of virtual care, and that these stats hold out outside of this organization as well. There's lots of information from around the world about this. And 17% is phone. So phone does count as virtual care. I think now we're seeing more and more. We end up talking to our providers on the phone to screen out office visits if they're not absolutely necessary. There are a lot of benefits to virtual care. 44% improvement in patient satisfaction. When you have email correspondence with your clinics, it's way more convenient. It's helpful for clinics. Clinics can be more efficient. They can be faster in addressing certain patient concerns. But the average time it takes for a patient like you and me to go to an office visit is an hour and a half out of your day. So if you can shrink that down to a 5-minute interaction over a secure email service like SecureMail, all the better. We know that providers using SecureMail report overall average an increase in daily visits. We've seen clinics increase the number of patients they can see in a day by 100%. So they've actually doubled the number of patients they can see in a day in some cases. We do have clinics that get up to about 20% increase, which is great for capacity in the system. Imagine if we could increase the capacity of the healthcare system by 10%. We end up with a huge boon. People are getting care more quickly. We develop fewer complications as we progress because our conditions are getting the treatment we need right away. There are indications in a lot of research that show that SecureMail increases provider satisfaction. A lot of that stems back to the fact that they're actually able to treat more patients because they're being more effective. They're better clinicians. They're getting more people the care that they need more quickly. And that's really what they want to do. We hear a lot about physician burnout because of all the information that's flying around, because they have to use certain technologies, or because they're not able to provide the care that they want to. And systems like SecureMail help them focus in that way. The other thing that's important to note, and as you go through a lot of the documentation about virtual care, the Canadian Medical Association just put out a very good report about, hey patients, here's how you should expect to use virtual care, and here's what you can get out of it. One of the major uses is a follow-up note. So I know when I go to the doctor with my kids, and after it's over, their mom might say, what happened? How did it go? I'm not totally clear on all the details. Even when I go myself, sometimes that treatment adherence can slip because we know that almost half of us don't leave the information what they need. And by the time we're in our car, we've forgotten a lot of what we were told. So it's a great way for us to request a follow-up, or clinics can just do it automatically. Hey, here's what you discussed with your doctor, just so you know. And we heard in our last patient webinar that we did that's now on our website, that it's really helpful from the patient that was talking with us. He uses it all the time to reference back. Here's what they said. Oh yeah, I'm supposed to be doing this. So it's really helpful in that sense. And then of course, sorry.
Sorry, I was just going to say, but if COVID has taught us nothing, what it's taught us is there's a more efficient way to do business. And this definitely is case in point of what you're saying here.
Absolutely. And I was going to add, Ingrid, that the key is to make sure that this is being done in a way that respects and protects your privacy and the privacy of all the patients at the clinic. Yeah, on a final note, I think in that sense, clinics we talk to, some of them do fully expect that 30% of their in-office visits will never come back, because we've all gotten a taste for the fact that I don't have to go to my clinic for these things, and the patient expectation is changing, but the expectation that hasn't changed or can't change is that we need to be safe and secure. I will say for those of you in Alberta, and we do have a number of Albertans on the call today, you can access SecureMail. You can connect your SecureMail account to your MyHealth Records account, which is a Government of Alberta service where you can access a lot of your patient information, some of your lab results, your appointment information some of the times. You can put your immunizations there. So it's a central place for you to store all of your information. And you can tie in your SecureMail account to the same place. So if you need to send something to one of your other providers, you can send it through SecureMail. They can send it to your SecureMail account, which is attached. So you have all your information in one place, which is a really important tool that helps patients access their information, which is really important to have that knowledge in your hands so that you can be more engaged, more informed, and actually work better with your providers in that sense. So you can sign up for that. If you haven't set up your MyHealth Records account, it's a quick thing to register, and then you have to get a piece of mail with a password just to verify your identity and make sure that no one else is accessing your information. So that now brings us to I think the end of our presentation. I do have a couple of questions. The first one's easy, I think. Can other providers use it? Yeah, so you can go through the directory. If you log into your SecureMail account, you'll see a professional directory on the left. You can search for other providers in there and see who's there. And if there's other providers that you work with, you can always connect with them and send them messages through there. They'll likely have some features turned on that will focus your message through their shared inbox through their front desk team, which is exactly how they should be doing things to make sure that you're getting the attention that you need in an efficient way.
Right, and this is because this is patient-centric, which it always should have been and it always was, but because we had health professionals all over the place, coming back to the patient as the center and in control of their own health information is huge.
Yep. Yeah, and the other thing that I will point out, because this addresses one of the other questions here, is that what about my other providers' tools? So some people have other portals, they're called, ways for you to access the information that they have about you. SecureMail is unique, and Ingrid, that's exactly the right point. I think this is a patient-centric tool, so you can communicate with all your providers rather than the 8 or 9 or 10 or 4 different providers that you work with, having a different tool for each one of them. This allows you to consolidate all of that communication through a single point, and that's really important from a patient perspective, because then you can you're not jumping around and trying to find where all the information is. You have it all in one place. And I think that brings us close to the end. I don't want to get into any further discussions so we don't go over here today. We have one little bit here where we're going to have a winner of the draw. The winner of the draw today is Jay. So congratulations on that. We'll be sending out a $25 gift certificate. Thank you for tuning in. And hopefully you learned something. Again, if you have any questions, always give us a call. You can access our support page too. So you have access to Brightsquid support at all times during regular business hours, I should point out. You can find out more information about SecureMail for patients on our website, brightsquid.com/pages/patients. or you can just go under the About tab in our navigation menu at the top. So thank you very much for tuning in today. Ingrid, any final words?
No, nothing additional. I mean, this is all about keeping your health information safe and secure and protected. And really, that's what it's all about.
Perfect. Yeah. Thank you so much. And I will point out clinics that have our privacy services as well. So we do offer Secure Mail. We do offer privacy support. They will have a sticker. They can have a sticker displayed in their door that looks just a lot like this with this Protect logo. So you can be sure that they're taking the steps they need, including educating all their staff about what's required to protect your information, and you can feel safe there. So thanks for tuning in. Have a great weekend.
Thank you.